Welcome to Healthy Focus, the Duke Raleigh Hospital Community Education Series.
Please join me in welcoming Tara Nixon and Emily Scheuring.
So thank you all so much for being here tonight and wanting to learn more about the singing voice and taking care of it. I often find that the voice is something that we tend to kind of take for granted. It's something that we do, we use our voice almost like the breath. We just breathe every day. We don't necessarily think about it a lot of times. And until something goes wrong. And then we begin to kind of consider how it works and what we can do to make it better. I'm sure that many or most of you, or maybe all of you, are singers in the audience here. And so we will be talking a lot about how to take care of the singing voice, okay? So we'll be kind of going through a couple different aspects of this. First, how the voice is produced, and my colleague Emily Scheuring will help us in this talk and present with this. Next, we'll kind of go over anatomy, the way that we evaluate the voice, as well as common lesions and disorders and injuries that we see with the voice. Next, we'll kind of go over ways to manage and prevent any injuries and disorders with the voice. And last but not least, we'll be talking about ways to stay fit with the voice and singing, okay? So, as we talked about before, voices are something that we often kind of maybe take for granted, but they are so meaningful and such an important part of everyone's life. They are part of who we are, our self-esteem and our self-image, but they're also our instrument as singers or people who maybe don't sing. Often, they're a part of how we actually earn our living. We need our voices to answer phones. If we're singers and that's part of our income, we do need our voice and be able to take care of that. It's also a part of our quality of life. So the voice is a source of creativity, expression, artistic expression, also a source of fun, communication, and of course spiritual worship. Now, all of these things can be jeopardized when we have a voice injury.
Thank you, Tara. My name's Emily Scheuring. It's wonderful to have you all here. Can I get a quick show of hands to see, is everybody here a singer? Who's a singer? So we have some singers and some people who are not singers, but who maybe want to be singers or learn about the singing voice? Okay. So of the singers, how many of you sing in a choir? In a praise team? Or a gospel group? Okay. Solo singers? Yes. All right, wonderful. So as singers, you guys are at risk for injury because of what you do with your voices. What you do with your voices is very athletic. We use our voices like athletes use their bodies. And athletes get injured all the time. We see it happen all the time. We have to use our voices at very extremes of range and loudness levels. We have to project our voices, sometimes without a microphone, even though we might need one. We use our voices more often than people who are not performers or singers, not only because we sing, but also because we're very talkative and outgoing and gregarious people. And also, some of us singers have occupational hazards and occupational considerations that can increase our amount of use and make it that much more athletic, putting us a little bit more at risk for an injury. So this is a great example of kind of a diagram for achieving vocal health or maintaining vocal health. It can be divided into medical factors, taking care of any medical problems contributing to a voice problem, we'll talk about what medical problems might be. Examples might be acid reflux, or a chronic runny nose, or postnasal drip, or asthma. Also, vocal hygiene is another part of this quadrant that just involves everyday measures to keep the voice healthy. I'm going to do a whole section on vocal hygiene and how to keep your voice healthy. Vocal efficiency is another quadrant here. Vocal efficiency means using your voice in a healthy, smooth, easy way and not forcing it or using it in a way that feels uncomfortable. Vocal pacing means staying within your own personal limits of amount of voice use and not surpassing that, so not overdoing it time-wise on a given day. If you have a problem with 1, 2, 3, or all 4 of these quadrants, you can put yourself at risk for a voice problem. Does anybody know how the voice works? Okay, well, this is your chance to learn. It can be helpful because the voice is so complex and involves so many parts to think of the voice as having 3 main parts. Now, the first part of the voice is going to be your power supply, and that is the lungs, yes, kind of powered by the belly, right? We use our bellies when we sing. That's the power source for the voice. The second part of the voice is the source of vibration, which you can see right here in the throat, is the voice box. The raw sound that creates our voice is generated here. And the third part of the voice is what we're called a resonator, or the vocal tract. So the raw sound created here then travels up through the resonator and is shaped and amplified into something that will eventually sound human. So if you were to remove this part of the voice, remove the resonator, and only have power and vibration, you would just have a very dull bzzz sound. It would not sound human. You wouldn't hear vowels. You wouldn't hear consonants. You wouldn't hear words. It would just be a bzzz. So everything that happens above that is really quite magical. And there is very complex science behind it, but we won't bore you with that today. If you place your hand in the front of your neck, kind of where, for men, right around where your Adam's apple is, and for women where where you might feel that, and just say, mm. Do you feel anything? Feel the vibration? What you're feeling is your vocal folds vibrating hundreds of times a second. For men, maybe it was about 100 times a second. For women, maybe about 200. When you're singing a really high note, that can go up to 1,000 times or more per second. So we cannot see this happen with the camera with the naked eye, and I'll show you how we can see it in just a few moments. If you were to remove the skin and everything covering the connective tissue on the front of your neck and just look at the muscles and the anatomy below it, what you see are all these strap muscles going around and in front of your voice box, which is right in here. It sits right on top of your trachea, which leads into your power source. So the voice box sits right on top of there. The air comes up from below through the trachea and comes up under the vocal folds, sets them into vibration. And that's where we get our sound starting. All these muscles around the voice box some of them can help with the voice, but they sometimes like to help too much. And some of those muscles are more for stabilization of the neck. However, sometimes some of us may feel that we're really using those muscles when we sing, and that can be a sign that there's too much effort happening in here for one reason or another. So here's just another view of the framework of the larynx. This is all kind of housed in cartilage, and it's suspended from one single bone in the entire unit, which is way up high in your neck. The vocal folds are inside this. So actually this is kind of looking at it through the side. But if we were looking this way from the very front, the vocal folds are just right behind there, and they're protected by that cartilage in the front. The vocal folds can open and close voluntarily by a group of muscles inside your larynx, when you take a deep breath in, taking a deep breath, the vocal folds open really wide like this. They're the gateway to your lungs. So they open up to allow the air to rush in. So this hole right in here goes straight down into the trachea and eventually leads to the lungs. When the vocal folds close, that's when we make sound. That's when we speak. That's when we sing. In a complex sentence, your vocal folds are opening and can be opening and closing quite a bit. So every time you take a breath, they're opening and then they close again. And they do all sorts of magical things as you're speaking as well. If we were to look at a cross-section of the vocal folds, so if we were to excise the vocal folds and kind of slice them in half and look at them from the very side, this is how they vibrate. So they come together in the very beginning as you prepare to make sound, and you have air coming up from below, which starts to open them from the bottom. And they eventually are open all the way through, and then by laws of some aerodynamic rules, the bottom lip of the vocal fold is sucked back into middle, and then they come back together. And that is just one cycle of vibration. So that happens hundreds of times a second in your throat. The more air you put below your vocal folds generally means that the more sound you're going to get. That's why we learn so many breathing exercises for singing. Also, the tightness of the closure can impact your sound as well, kind of the intensity of the sound. And vocal folds that are closed too tightly can lead to problems as well. So the pitch changes by a set of muscles that are out right in this area here that actually pull that top part of the cartilage down, which pulls the vocal folds longer. So the longer they become, the higher our pitch becomes. Kind of like using, when they become longer, they become more tense, and the pitch becomes higher as a result. Kind of like when you play the guitar, the higher you move up on the frets or on the string, the higher the pitch becomes. You are tensing that string, the higher you move up. Here's another image of that. This is a nice picture of the actual vocal folds instead of a diagram now. So you see all of these layers of mucosa over it. We don't see muscles or cartilage here. It's all covered. But these white bands right here are the vocal folds. And here you see they're a little bit shorter. That person is probably singing a lower note or speaking in their average speaking range. And here they've lengthened, so they might be speaking higher or even singing a higher note here. It's kind of like stretching out a rubber band. The vocal folds have a very complex and dynamic makeup, and there's a really special material encapsulated within the vocal fold, which is kind of like jello. And that jello-y layer is what makes our sound so complex and what allows us to kind of do with our singing voices. When that jello layer becomes damaged, it can scar and become more firm. So we need it to stay very jello-y and very soft and jiggly. And again, the vocal tract is going to shape our sound to create the human voice. The vocal tract is what we manipulate to sing in different styles. So if some of you have crossover styles, what you're doing to achieve that difference in style and that different sound that you achieve is change the shape of your vocal tract, change the shape of your resonator. There really aren't changes occurring here. It's mostly happening up here, and we can talk a little bit more about that later today. Here's a nice video. We're so fortunate to have the technology today to see the vocal folds in person and to be able to slow down the vibration. So this isn't actually slowed down, but the way we're looking at the vocal folds here, actually in vibration, is with a stroboscope. And it has a strobe light on the end, which allows us to capture each phase of vibration, and it kind of juxtaposes that into what looks like a video. So it's kind of like when somebody dances in a strobe light, it looks like they're dancing very slow. So this allows us to see what vibration might look like if it were slowed down. And it's quite accurate and very useful for us in the clinic. I don't know if you can hear this, but this person is just sustaining a sound. They might be saying, I think they're saying E. And when the vocal folds are vibrating like that, that's when she's making the sound. And here she breathes, and then back together. So this is happening all the time in your throat without you really thinking about it or controlling it. It just does it. So this type of exam gives us a lot of information about somebody's vocal folds. If they have a complaint, we can usually, by looking at this, figure out what might be going on and what their problems might be leading to their complaints. Okay, and Tara's going to come up and talk about what happens when somebody experiences a voice problem or when things seem to go wrong with the voice.
So the vocal folds that we just saw were prime examples of very, very healthy voices and vocal folds. They were moving easily, the mucosa looked intact, nice coloring, but we might see some other examples of voice injuries and voice disorders. And some things that you might hear from people that do have some of these voice injuries and voice disorders, and if you've ever noticed that you've had difficulties with your voice in your own life, you might express some of these things. I get tired when I sing. I might have lost some of my upper pitches. Sometimes I get hoarse after I sing or while I'm singing. A lot of times we see patients that have gotten just a cold, and typically, you have a cold for a little bit and then you get better and you go back to normal. Well, especially for us singers, that cold might get us into a certain kind of pattern where our voice doesn't recover the way that it should. And so that's something that we often see. I got a cold and my voice never recovered. Also, you might experience some voice breaks or cracking when you try to go hit a note. That typically would be easy. So some factors that might kind of contribute to some of these problems with the voice are inefficient use of the voice. And Emily brought up a little bit earlier about vocal efficiency. One of the recommendations that we make to singers is that find a teacher for your voice. So if you can find somebody that you can learn from and that knows what they're doing and knows how to sing in a really efficient way and can teach that, that can be one of the most beneficial things for a healthy singer. Also, learning how to use your speaking voice correctly. It's the same instrument whether you're speaking or singing, and we'll talk a little bit about that as well. So some bodily things that can happen are just getting an infection, upper respiratory infection, chronic irritation such as allergies, postnasal drip, reflux. Of course, smoking is something that you want to avoid, secondhand smoke and smoking yourself. We do not want to do that for singers or for the voice in general. And some things that can kind of alter the mucus, which we'll be able to see a picture of later, are not getting enough water. So staying hydrated, drinking 64 ounces of water every day is a huge recommendation that we make to many of our patients. And then also not drinking too much caffeine. Caffeine can tend to kind of dehydrate the body. So even if you are getting a lot of water, you want to stay clear of drinking too much caffeine. We often recommend no more than 2 small servings of a caffeinated beverage each day. So as a part of some of that kind of inefficient voice use that we were talking about earlier, that use is repeated. And that repetitive use kind of can lead to a traumatic lesion, traumatic injury. The vocal folds, as you saw, vibrate together over and over again and can develop calluses or lesions. They arise in the outer layers of the vocal folds, so often they're very easy to visualize. They can result from using your breath in a really inefficient way, not coordinating it with the voice. An example of that you might hear is what we call glottal fry. So right now I'm using my breath and trying to coordinate it with my vocal fold vibration. If I stop the breath and I kind of talk like this, so my voice is really strained. Now there's kind of a spectrum of strain that can create different sounds like that. You will not have the breath coordinated with the voice when you're straining your voice like that. Of course, as Emily mentioned earlier, vocal pacing and pacing your voice use is a huge component of avoiding vocal injuries. So kind of finding what your limits and your limits for your vocal clock are, and we'll talk a little bit more about that in a second. So these types of factors can interfere with how your vocal folds vibrate, and the cover will stiffen, and they also affect how easily the vocal folds close. So here's some pictures of things that we would prefer not to see as singers. Up here on the top left, these are nodules, vocal fold nodules, and they're kind of the taboo a lot of times in the singing world. Has anyone seen the movie Pitch Perfect? And that's kind of the, I have vocal fold nodes. This is what you would see. They're bilateral lesions. They develop on both vocal folds, typically about the same size. Sometimes one can be a little bit more prominent. This is something that we, want to kind of soften up. We would treat this often in therapy and learning more efficient ways to produce the voice, to soften these and get them smaller and improve vibration and closure. Here we have what we call a hemorrhagic polyp. So it's a polypoid lesion that has that obviously is something that can really impair how well those vocal folds are vibrating and will affect the sound. Okay. Here we have a varix or a vessel in the actually that would be the left vocal fold, and a lot of times with voice overuse or voice misuse, inefficient voicing, that varix, that vessel, will lead to a hemorrhage. And this is what we would see. This is kind of what we consider the one true vocal emergency that often would cause you to just lose your voice immediately. And we don't want to see that happen. This is when if we see this, we would recommend you to go to rest your voice immediately for about 7 days, and of course follow up with evaluation and treatment as indicated. Here we have a cyst, and that's actually kind of a development of a lesion below the mucus. It's a submucosal cyst. So you can see it's kind of a bulbous shape underneath this left vocal fold. And then here we have kind of a fibrotic scarring of the vocal folds. This is another thing that is not something that we would want to see because it is more difficult to treat, this really well-developed scarring of the vocal folds. Some other things that we would see that would affect the qualities and stamina in your voice are thick mucus, and as I mentioned earlier, not drinking enough water, and also perhaps being dehydrated from drinking too much caffeine, or even nasal drainage, reflux can all cause thick mucus to adhere to the vocal fold surface. As Emily mentioned earlier, we also have many muscles surrounding the larynx, right, that can often do really important jobs, but sometimes they will work a little too hard, and that is when we see this squeezing of these muscles and cartilages just above the vocal folds. So you see here we have these two vocal folds that typically you would like to be able to see the entire span. Here we have what are called the false vocal folds, or the ventricular folds, squeezing together, which affects the sound. So not only do we have kind of repetitive voice use injuries that can kind of build up the vocal folds and affect closure and vibration, but with each number of birthdays, we also might experience a loss of muscle bulk, which can actually kind of atrophy or cause bowing of those vocal folds. So they aren't able to close as easily. And you might experience some voice changes from this as well, such as kind of loss of agility in the voice, not able to move as flexibly or as easily. Voice breaks, difficulties transitioning between your registers from your head voice to your chest voice, and vice versa. Changes in how you're using your breath support, and also a decreased range, whether upper or lower. Often we experience a lowered range in our older age. And then unsteady vibrato. But the good news about the vocal fold atrophy, age-related voice changes, is that singing is good for you. It's exercise. So that is good news indeed. And it can actually help you regain some of that function that you've lost if you're singing in an efficient way. And of course, taking care of your hygiene as well, your vocal hygiene. So with all of these injuries that we see and disorders, there are many ways to manage them. And we do that by first evaluating and seeing what actually is going on at the level of the larynx, and how you are taking care of your voice and yourself and your body. And we would address that in voice therapy, and giving you more efficient ways to use your voice, whether speaking or singing. We also work with physicians that are part of our Duke Voice Care Center team that provide medical management, of course taking care of the medical factors that might influence your voice. And if surgery is indicated, then that would be managed by the physicians as well, followed by voice therapy for the speaking and more high-intensity voice use as well. Okay. And now Emily's going to talk about that behavioral management.
Okay, the good news. So it's great news that when somebody has a voice problem, there are a lot of things we can do to get better. And the even better news is that you can actually prevent these problems from happening just by kind of knowing your limits and knowing some basic vocal hygiene and pacing of your voice use. Vocal hygiene, again, like I said earlier, it's everything we do in any given day to keep our voice healthy. So for me, that means drinking water starting first thing in the morning, not drinking too much coffee. It means knowing when to stop singing, when I may be using my voice in an unhealthy way, staying out of places that cause me to use my voice in an unhealthy way. Hydration, 64 ounces of water a day is kind of the standard recommendation from a lot of types of physicians, but especially for the voice, and there's pretty good evidence to back that up, that hydration keeps your vocal folds supple and working in prime condition. It's so important. Sometimes having good hydration can make all the difference for some people who come in with a voice problem. Reflux is another biggie. Allergies. Smoking. No smoking. Obviously, smoking is bad for a lot of reasons, but smoking is bad for the voice. It burns your vocal folds and can cause changes even with a small amount of smoking. Having a cough. You may notice that you get hoarse when you start coughing, or if you clear your throat a lot, it starts to affect your voice. These things are generally advised against if it's possible. Actually, I want to go elaborate on this a little bit more. If you know that you have reflux or you have some symptoms of reflux, it's best to talk with your doctor. You could even start with your primary care physician to talk about reflux. Usually they are well equipped to treat that. But there are also a lot of lifestyle and behavioral things you can do to manage that. But reflux can really affect the voice if that's something that's happening regularly. If it's occasional, you could probably treat it on the occasion, and hopefully that's not going to affect you too much. But if you notice it's something that's happening with pretty regularly, it's good to talk to your healthcare provider about that. Chronic allergies cause swelling of the tissues in the nose and the throat, and can also cause a consistent postnasal drip, which irritates those membranes and can make it a little more effortful and troublesome to sing. All of these things put you at an increased risk for having a voice problem. So dehydration, having chronic reflux or allergies, smoking, or having a chronic cough, or even just a severe cough with a cold that you might have, as well as throat clearing. So how do you avoid getting sick? Well, we all know some of these things, but taking care of your voice is about taking care of your whole body and maximizing your resistance to illness. So getting lots of sleep, eating healthily, getting exercise. These are all things that keep our immune system working in top form. Singers have to be compulsive hand washers just all the time. Keep some sanitizer with you and keep those hands clean. People who get sick often frequently find themselves with voice problems. So having a healthy voice is about using your voice in a healthy way. I alluded to this earlier very briefly, but when I talked about vocal efficiency, what that really means is when your vocal folds come together, they should come together in an easy, gentle way, so that when they make contact, it's gentle. What you don't want is forceful contact. That forceful contact affects that jello layer and can cause some problems to surface if that forceful contact is excessive and if it's consistently used. What are some things that cause that forceful contact? Well, pretty much everything on this list. So, but first of all, singing in a way that is perhaps not as efficient as it could be, forcing or pushing the singing voice. Any speaking voice behaviors like yelling, screaming, throat clearing, and coughing, like I mentioned earlier. Loud talking is often unseen. Loud restaurants. It seems like any restaurant is loud anymore. Talking in those places where you have a lot of background noise forces you to raise your voice a lot. And doing that regularly for singers cannot be good. It can really build, especially if you've been singing a lot on top of that. If you're sick and your voice is affected, if you become hoarse when you're ill, it is best to rest your voice as much as you can during that time until you feel that your voice is better. And our general guideline is if you have a voice problem for longer than 2 weeks, it's good to get it checked out. Other ideas for avoiding injuries, if you are one of those people who likes to go to sporting events and is very vocal at sporting events, use a noisemaker or some other method to cheer on your team. You could put some coins in a milk jug. It's very loud. It works really well. If you find yourself in a loud environment and you're unable to avoid that environment, get close to the person that you're talking to and keep eye contact with them, and that's going to help solidify your communication. Or try and move to a quieter area. How many singers in here warm up before they sing? Every time. The hands just went down. For choir singers, how many of you warm up on your own at home before you go to choir? Good. That's a good habit to be in. Okay, warming up is one of the best things you can do for your voice. What warm-ups do, especially if they're kind of designed for you and if they were given to you by a teacher who kind of prescribed them for you to work on your specific goals, they help kind of get your instrument in balance so that any singing that follows that day kind of stays in that balance that you established in the beginning. In addition to that, they also kind of they warm up the muscles, just like a slow jog is going to warm you up for a running race. So you're warming up those muscles and getting them limber. It's going to help you find your agility and flexibility for singing thereafter. Has anybody ever cooled down their voice? You're good. You've got good habits.
I've been trained well.
Yeah, good. A cool down can be performed very similarly to a warm-up, but that's another important thing to consider putting into your day, the day that you're singing. So warm up, do your thing, do what you need to sing what you need to sing, and then cool down at the end. If you've never had voice lessons, it's always a good idea to work with a teacher and have an extra set of eyes and ears on you to provide suggestions for helping you find that efficiency that we might all be looking for. For some of us, it doesn't come as naturally as it might seem for others, and everybody kind of works differently. So it'll be important to find a teacher that knows your voice and can give you really honest suggestions for maximizing your voice and making it as efficient as possible. That's a good way to prevent an injury. Using your speaking voice well, it's all the same instrument. So we talk about getting voice lessons for the singing voice, but it's also important to use the speaking voice in a healthy way too. A lot of singers put a lot of attention and effort into really maximizing their singing voice, and they never pay any attention to their speaking voice. Well, maybe they'll end up with a problem because they're using their speaking voice more than they sing, and that has predisposed them to some issues. So a lot of the things that we do to help our singing voice can apply to the speaking voice, and these things include using good posture, using good breath support to support the speaking voice and not speaking without breath, as Tara demonstrated, which results in a lot of that strain and pressing of the vocal folds. Using a voice that feels like it's placed very forward when you speak and when you sing. You may feel like there's vibration in the front of your face or below your nose or in the roof of your mouth. You may just feel a resonance shift when that happens. It won't feel like the voice is back in the throat. And working with whoever you can to minimize muscle tension and straining that may go into the speaking voice as well as the singing voice. And sometimes singing teachers can have great suggestions for the speaking voice too, so you can really learn a lot from them. And Tara's going to talk about vocal pacing and budgeting your voice use.
All right, so vocal pacing is another one of those number one recommendations that we make to our singers. We work with a lot of people who not only love to sing, but also have day jobs, right? And we're talking all day. It could be on the phone, it could be one-on-one, you could be teachers or directors and have to talk to large groups of people. So let's talk a little bit about ways to kind of strategize your voice use. So, we've already mentioned it, but Does anybody have an idea of what that vocal pacing golden rule might be? It's warm up your voice before singing. And then, of course, cool down your voice after singing. We'll be able to talk a little bit about really good ways to do that, okay? Number two, I brought up the idea of a vocal clock earlier. This is something that can be so helpful to kind of have an image in your mind of how often you can use your voice and ideas for rest. So think about if you spend 7 hours a day, at work, 7 to 8 hours in contact with someone, and for every 45 minutes you talk, maybe allowing 15 minutes of voice rest. And that can be very helpful in preventing some of those repetitive use injuries that you saw earlier. That helps to add on time for the voice later. It helps you to prioritize when you want to use your voice in an efficient way, okay? So look for opportunities to give yourself these voice breaks. You could also kind of schedule out how you're using your voice. So, for example, take the week ahead, or even the month ahead, or the several months ahead, and mark down where you are going to have these really important voice use times, whether it's speaking or singing. If you know you have a 2-hour lecture on Friday that you're giving, or a conference call that you're going to have to be responsible for talking a lot, or for us singers, a big performance on Saturday night, right? Maybe plan for the couple hours or day before to be your voice rest time and having offloaded some of that voice use, and the day after as well. And you could even kind of color code this and really plan out how you're using and how you're resting your voice. Okay. Of course, during rehearsals, you can also kind of monitor how you're using your voice. Marking is a really helpful thing. If you notice that you're feeling fatigued with your voice or getting tired with your voice at all, rather than singing full out for the dress rehearsal the day before the performance, or during just any general rehearsal or practice time, you can maybe take the loudness level down, and that will help to kind of modify and pace your voice. And as Emily said, we also want to monitor the speaking voice and look for times to rest the voice in your speaking social life as well. Okay, we often talk about this idea of the art of the brief appearance, and this is where you know that you have to go to an event, but you have a big voice use performance, or even speaking voice use the next day, and you want to take care of yourself. You want to be able to rest it, but you have this other thing that you have to do. Well, maybe still go to the party or the meeting, but show up when it's appropriately and fashionably late, and then talk to the people that you need to talk to, right? Make connections where you need to make them, and then when you've done that, you can go home, and that will be that much less voice use that you have taken away from that time on your vocal clock, okay? As we talked about just a second ago, monitoring your voice use in rehearsal, watching your dynamic levels so that you're not always at a 10 out of 10 of loudness every single time, kind of keeping track of where your limits are. Okay. Now, of course, for singers, it's important to know our own limits, whether it's your range. If you are, a soprano, you don't want to be singing the tenor range, and if you're a tenor and it's not comfortable to sing in the range above where you can sing, we want to avoid that. And of course, training will help you to kind of identify where your range lies. Loudness, knowing your limits for that, and also what your vocal clock time is. Some people it might be 3 hours. Some people it might be 2. It might vary depending on your voice responsibilities each day, and that's important to be aware of. And let's talk a little bit about ways to kind of practice without having to overuse your voice. So I want to see a show of hands. If you are practicing a song, how many of us want to just sing it over and over again until we know all the words and we know the melodies? Okay, I see a couple hands. Some more strategic ways to actually practice might involve not even singing at all. So it gives you an opportunity, again, to put time on that vocal clock, rest your voice while still working on the music. So maybe listen to the song a few times and think through it. So you're giving yourself time to mentally practice the song. You could also use some of these breath flow and coordination strategies that we'll be going over in just a second to actually practice the way you're using your breath through the song. So, for example, if you're singing Happy Birthday, you could say Now, of course, you wouldn't be able to tell that I'm practicing Happy Birthday, but I'm also practicing my abdominal engagement for the phrasing of those songs and lining that up to prepare for when I'm involving my voice in my practice. And then, of course, memorization for lyrics and kind of ways to interpret the song can be really important to strategize before actually singing through the piece. Okay. Oh, and there's one more thing. So another kind of advanced way to practice is, rather than singing through the whole song over and over again, identifying parts of the piece that might need a little bit more help. So if you know all of the choruses but need to work a little bit more on the verses, then spend some time on that portion and maybe just come back to, every once in a while, the parts that you know. Okay? Good. So is anyone here a director of a choir or a music educator? Okay, great. So thank you for being here. Here is a couple special considerations that you might want to take with you. Of course, it's important to warm up your own voice before you rehearse, right? We often consider with our students, okay, I need to warm up my student's voice, my choir's voice. Remember, you're part of that too. You're part of that group. So warming up your own voice before you worry about anybody else's. Also, amplification is another of those number one recommendations that we make to teachers and directors that we work with. Getting, for example, a microphone like this. We also recommend amplification devices that you can find and use so that you don't have to overuse your voice for the entire room, right? Also using some strategies like printed signs to designate things that you tend to kind of repeat over and over again, hand signals, or delegating some of your voice use to people in the choir or your students can be very, very helpful. Another recommendation we make is actually making CDs or recordings of things that you tend to kind of repeat, or even parts of the song that you know you're going to be going through and teaching. Rather than having to sing it yourself over and over again or sing the different parts, record it once, and then you can just click right on the track that you need to have the CD player or the sound system perform for you. And of course, remember that you are your own instrument. Your voice is your instrument. So, as singers and music educators and voice users, we have greater voice demands than people who don't necessarily sing as a part of their everyday life. So you want to take care of yourself. So before we get into the questions, let's talk a little bit about ways to exercise the voice. And I have a question. Does everyone have a straw? Does anyone not have a straw? besides me? Okay, great. Okay, so we'll be using that in just a second. Thanks, Rita. So, as Emily said, we are vocal athletes, and we need to be able to exercise and condition our voices to use them efficiently and well. So let's go over some things that I think would be helpful to know just in your everyday practice, in your everyday life. So, let's see here. Thank you so much. All right, so we will use the straw in just a minute. First, let's start with some voice saving, some voice rest activities that we can still use to help warm up the body and the voice, the muscles of the voice. So we can start by standing, if you feel comfortable standing. And this is something, I want you to kind of trust how you're feeling with this. We're going to do some relaxation and stretching exercises and massages. If you feel uncomfortable or feeling any sort of pain, please take a rest, sit down, just trust how you're feeling, okay? So first, let's find a comfortable way of standing. Your feet are going to be about hip width apart, and Emily's going to be coming around to help adjust people and improve how you're doing these. So we're going to keep our feet about hip width apart. Remember, we want to feel comfortable. Don't let your knees get too flexed. We want to keep them nice and soft. Feeling almost as if there's kind of a string coming out of the top of your head, right? Your jaw is parallel to the floor. You're not too far leaned forward on the balls of your feet, not too far back on the heels, nice and balanced, okay? And also, kind of remembering that the rib cage is an important part of breathing. So feeling as if there's kind of a hook right under your sternum. So it's not wanting to drop down when we're singing or when we go to take a deep breath and then exhale. We don't want to see that. We want it to be nice and elevated all the way through, okay? So first through this, we're just going to kind of cover these pretty briefly. You can take your time with this when you're doing these on your own, okay? So let's take our fingertips and start at the forehead and just rub very gently through the forehead and the temples and through the cheeks and the jaw. And I like to remind people and myself to not forget your breath as you're doing these, right? Sometimes we have the tendency to want to kind of hold the breath. Let it flow, okay? So moving on through the jaw here, a lot of very important muscles involved in singing throughout the face. Very good. And massaging these big muscles of the jaw. Excellent. Next, let's walk the thumbs along the base of the tongue here, which again is a very important articulator for singing and for speaking. Several muscles directly connected to the larynx via the hyoid bone, that bone that you saw that suspends the larynx, are connected to the tongue. So this helps to kind of relax those. It should be really flexible, really pliable and easy to kind of move around. And then next, this is what we call the laryngeal massage. You're going to take your thumb and forefinger and start kind of at the crook of the neck here and very gently rub in a downward motion. And what that does is it helps to relax the muscles that are surrounding your voice box. So this is important to do often after singing. You might notice a little bit of tightness here. We want to for those muscles to relax. This is something you can do 5 to 10 repetitions, really at any point throughout the day. And again, it should be comfortable. It shouldn't be painful. Okay? Good. So next, we're going to do something kind of fun. And if you have any, if you're a teacher or if you're a choir director, this can be a lot of fun to do but I find as an adult I like to do this as well, okay? So what we're going to do first, lion face, fish face. So lion face, fish face. Scrunched up. Lion face, nice and wide. Fish face. 2 more times. Lion face, fish face. Lion face, fish face. Very good. Very good. And then we can also, if you want to keep your hands right here on the jaw, again, if you're noticing any discomfort, we can just sit back and listen. First of all, let's kind of notice these muscles in the jaw. Notice when you're opening them, you're kind of softening the jaw and allowing it to open. Good, and just allowing it to relax. And then we can go ahead and close. Let's do that 2 more times. Open the jaw and close. And then open and close. Next, to that, we're going to add actually sticking out the tongue, okay? So this is almost where you want the tongue to kind of reach, feeling as if it's going to reach the floor, okay? So let's soften the jaw again and stick the tongue out. You can hold this for 3 breaths, okay? And whenever you're finished with those 3 breaths, bring the tongue back in. Let's do that 1 more time. Good. Now you should be able to feel a little bit of a stretch kind of at the top and the back of the tongue. So if you see my hand, this kind of represents my tongue. And the stretch will be kind of at the top and the back, right? And that, again, helps to relax and relieve some of the tension of the muscles that are helping with articulation in your vocal tract, okay? Next, we'll go over a couple of these neck stretches. First of all, leaning the head over to one side. And just do this if it's comfortable for you. You're going to feel a nice stretch on the side of your neck. And don't hold your breath. And then we'll lean over to the other side. Trying to involve just the muscles that we want, so avoiding any extraneous movements. And we'll do that 1 more time each side. Good. And over to the opposite side. Very good. And then next, we can, this is often easier to kind of watch before you do. You actually lean over, move your head to one side, and then, I'll use this mic, and then kind of circle the head around the front of the body over to the other side, as if you're kind of looking to the person right next to you. So let's start over on the left side. Good, and then circling around over to the right. You can do this as slowly as you like, as slowly and smoothly as is comfortable. Very good. And then next, the shoulders are a part of the body that we often kind of hold a lot of tension, and I think especially us singers. So let's do some shoulder rolls. We're going to bring the shoulders up and back. And use your breath to kind of lead you through these movements. And just allow your arms to kind of hang free. And some of you might be holding your straws, but... All right, and then let's go in the opposite direction. So up and forward and down. How many of you know or have heard the term diaphragmatic breathing? How many of you could describe what that means? Right? It's something that people say, well, breathe with your diaphragm. Well, what does that mean, you know? So let's talk a little bit about that. So the diaphragm is this muscle, and it is connected all along the bottom part of your rib cage, your sternum and your spine, and it's in kind of a convex shape so that when you go to take a breath, it contracts and flattens out. Now, we also have heard of lower abdominal breathing, anything like that. So we describe it that way because the abdominal muscles are also a part of this diaphragmatic breathing. So let's practice this a little bit. So I'm going to ask everyone to just breathe out all their air and then sniff in. So what are we feeling? You might be feeling some expansion around the belly when you go to breathe in, almost like a balloon, where when you breathe in, these lungs and the rib cage is expanding, the diaphragm is pushing down, these abdominal muscles are actually releasing, and so the contents of the belly have to be able to go somewhere, right? So when we breathe in, you should be feeling this abdominal muscles releasing and feeling some space around the belly. Now, I'm going to ask you to do one more thing. So we're going to breathe in and then hold out for as long as you can, okay? Excellent. So we've got some really great breath controllers here. Some good breath support. So something that you might have felt or noticed with your hands on your stomach is a sense of kind of abdominal engagement. And that is exactly what you were doing. We were engaging those abdominal muscles in order to kind of support the sound and keep the sound consistent. That is something that as singers, we really should be able to use efficiently and access efficiently. So I'm going to play a video here just to kind of show you what's happening with this. Now watch his stomach when he breathes. Very engaged right now. And then when he goes to take a breath, you see it expands, right? Very triumphant. But he was able to, both of them, you were able to see the abdominal muscles contracting and engaging as they were singing, okay? Good. So we did a little bit of this where you take a nice deep breath in and you feel that expansion, and then you'll be able to exhale. We could try that together right now, and feel free to sit if you'd like to, or stand. But keeping your hands on your stomach so that you can feel this movement, okay? So, can anyone do lip trills or tongue trills? Yeah, let's try that if you can do that. Mm-hmm. You might be able to notice some of that engagement there. Mm-hmm. So those are all unvoiced sounds. Where, like we saw earlier, the vocal folds are open. Now, we can add the voice to that and get the vocal folds to vibrate by changing the s to a z, or doing a voiced lip trill, right? So that's a really, really helpful, what we call semi-occluded vocal tract sound, where the vocal tract is partially occluding the air so that you can feel the air moving through your mouth. So if you want to go ahead and have a seat for a little bit, let's talk about some ways to exercise efficiently with your voice. You might wonder, well, what am I supposed to do to exercise my voice? What sounds do I make? What pitches do I use? And we'll talk a little bit about ways to kind of warm up your voice in a really efficient way. So as I mentioned earlier, just a second ago, semi-occluded vocal tract sounds are helpful because they help you feel the air moving through your vocal tract. Some of these examples of these sounds: lip trills, tongue trills, raspberry, a kazoo buzz, right? Other sounds like zzz. How about let's try that? So let's all do a like V for Victor. Probably feeling a good bit of vibration or kind of a tickling sensation right where the teeth are meeting the bottom lip, right? Yes. So that is a really helpful way to kind of achieve that resonance that we want in our speaking and our singing voice, in fact. Now, here we have straw phonation. So let's get out our straws here. No need to bend them, but let's try this. So we're actually going to be kind of singing through the straw, okay? So we're going to just try whoo. Just a comfortable pitch for you. Still feeling any sort of vibration where the straw's meeting the lips? Good, that's very good. Now, another thing that I would like for you to try is noticing where the air is going. So you'll be singing through the straw and see if there's any air coming through the opposite end of the straw. Who's feeling the air? Good. So that's what we want. We want to be able to feel the air moving, right? Because that means that the air is the main power source for the vocal folds to vibrate, and it's resonating in a way that is efficient, okay? If you're not achieving the air, and it doesn't have to be a lot, but if you're not feeling the air moving through the end of the straw, you could start with an H, and try to keep the breath really continuous through that, okay? Just like we're talking about singing lip trills and breathing sounds to help you practice your songs, you could practice your songs through a straw, right? So that could be something that can be a really helpful warm-up as well. A way to kind of challenge yourself with this straw, what we call phonation or vocalizing, is maybe squeezing it about halfway. So obviously we want the air to come through, so don't squeeze it all the way, but making it about halfway closed can be a helpful tool. Also using, those little coffee stirrers, those can be a really, really kind of magnifying glass into how the vocal folds are vibrating and how the breath is being used. Nasal sounds are also really helpful because they help to promote resonance. And you can also feel them. So let's try humming. So just as you felt earlier, your vocal folds vibrating, now you're hopefully feeling a little bit of vibratory sensation with the air moving through your vocal tract, okay? So all of these sounds help to promote the breath flow, relaxation of the muscles that should be relaxed when we're using our voice. They also help to exercise your control over your dynamics or your loudness. And then, of course, the resonance, that frontal placement of the tone that can help to kind of give you an acoustic boost to your sound so that you don't have to force it. All right. So now, if we're talking about warm-ups and exercises for the singing voice, some of these sounds can help to promote more specific things. So, for example, using a nasal consonant and going into a vowel such as me, right? That helps to improve the resonance of the sound. It also, if we use a y sound, yeah, that helps to promote jaw stability, decreasing in tension in the tongue and the jaw, which can play a part in the resonance of our sound. And then, of course, as we talked about a second ago, lip trills and tongue trills going into a vowel sound helps to promote that really steady and efficient breath flow. So what pitch patterns should we use when we're exercising our voice? Glides are something that we often use in voice therapy and singers use so that they can promote a really steady transition of the breath and also transition from one register to the other. It also helps to kind of stretch out the vocal folds and promote a flexibility of the muscles there. And of course, kind of helps you to monitor your own breath flow. So glides are really helpful. Let's try that all together. Excellent. We have some great singers in this room. Very great. Everyone's right on pitch. Wonderful. And then another thing that you could do, that was a 1-3-1, 1-3-1. That's kind of a smaller interval. We could also go into larger intervals and see how comfortable we feel in those glides. So 1-5-1. Now, I was using words and numbers. We could also try it with a lip trill or the straw. So let's get out the straw again and do. Thank you, yes. Very good. And then even extending into an octave. So there are multiple different things that you can do to help promote the flexibility and promote growth in the pitch range of your voice. Now, we also have scales as well as glides. So 1, 2, 3, 4, 5, 4, 3, 2, 1. Kind of a stepwise movement. They help to promote kind of the flexibility of the voice, agility, and also how precisely you can get those pitches. And of course, alternating between the glides and the scales will help to encourage that breath control that we want. Okay, so let's try that together. So we're going to use the straw and do let's do a 1, 2, 3, 4, 5, 1. So. Okay, now let's do that all again. Good, and I know I'm awkwardly holding the microphone, but good, okay. Now, we also have arpeggios, okay, and that's kind of a fancy Italian word for different pitches that are not stepwise. So 1, 3, 5, 3, 1, 1, 3, 5, 8, 5, 3, 1, or okay. So that helps to kind of monitor how easily you're able to connect with the breath and the voice. Let's try that together. We can do it with a straw. Okay, one more time. Very good. Now, we've done a lot of the legato, the very smooth exercises. We could also do a little bit of staccato exercises too, and that also helps to promote precision and pitch accuracy. So let's try something a little bit more staccato, a little bit more pinpoint. And this could be, for example, that same arpeggio that we just did, but staccato. So let's try that through the straw. Excellent. And these exercises are important in promoting flexibility. You can work through where your range is comfortable and see how it grows or changes. So now we're getting to the point where we're at the end of our practice. We can feel a little bit, we can focus on cooling down the voice. So how do we do that? Let's return to that laryngeal massage that we did earlier. Okay. So starting at the very crook of the neck and very gently moving in a downward motion through these muscles here. If there's a point where you're feeling a little bit more tender or sore, you can do a very gentle circular motion in that area. That's important for cooling down. We could also begin to kind of glide down from the upper part of the range, the more extensive part of the range, down into more of the speaking voice. So, ooh, 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 So now you're getting more into that speaking voice range that you use your voice to communicate with. And then in voice therapy, we often go through some different resonant voice and speaking voice exercises using some of those semi-occluded vocal tract sounds in our everyday speech. So that's something that you could also use to cool down with. Moo, mo, my. Now you try. Moo, mo, my. So you might be able to, again, use that sense of resonant vibration at the lips to launch into those vowels and back into your speaking range. Okay? So we're kind of ending our talk here. How will you know if you have a voice injury? And this is something that every singer, I think, should be aware of. As Emily mentioned, if you do have any sort of change or hoarseness with your voice for over 2 weeks, please come in and get it checked out. It's always better to know that you don't have a problem than to continue living with a difficulty that can affect your everyday life and something that you enjoy so much as singing. Some of these difficulties might be just a loss of your dynamic range, the inability to control your pitch. You might have hoarseness. There might be a change in the amount of effort it takes to speak or sing. And of course, if you're feeling like your stamina has decreased. And of course, please remember that we, the Duke Voice Care Center, the team that I work with, we are in the Raleigh and Durham sites. We're actually just right over in the Duke Medicine Plaza. And we really act as a team. We take the team approach, and our patients are part of that team. And so it's the physician, the laryngologist, who has extensive training and experience in taking care of voices. And then, of course, speech pathologists that are specialized in training, rehabilitating and evaluating voices and people with voice disorders. And, of course, as Emily and I and my colleague Lita Scarce, we are all people that know about the singing voice as well. So if you are a singer and you have any difficulties with your voice, you'll want to work with somebody who specializes in the singing voice. And of course, as a singer, you do owe it to your voice to get the care that you deserve. So we'll be, if you have any questions, please let us know. And thank you so much for joining us tonight, and I hope you have some questions for us. Okay?